Now, going through some of those puffers, Ventolin is the most basic of asthma treatments, and I'm going to show you Ventolin today. Ventolin is a grey puffer. It looks like this. It has a few different names. This one is called Asthma, and the medication Ventolin is designed to open up the lungs and reverse that restriction or that constriction of the lungs. It comes out like a mist or a steam. The best way to give Ventolin is through what's called a spacer or a tube. That helps the medicine stay in the tube for longer, and then the child will get more of the medicine. So applying it to a tube or a spacer, spray the Ventolin, and depending on the age of the child, they may have a mask or they may use a spacer without a mask and put their mouth straight over a plastic rim of the edge of the spacer. So putting the mask over the child's mouth and nose, spraying the Ventolin, the child will breathe about 4 times. Now I often say to parents, for the first few times doing this, it can be a little bit daunting or scary, and the child might cry or scream. Now that can be a good thing because you know they're breathing the Ventolin in. It can be helpful as well to sing a song to help calm their nerves. A good rule of thumb is to try 4 puffs of Ventolin. So we spray, we get them to breathe 4 times. We're going to spray again, we get them to breathe 4 times. That rule 4, 4 and 4 is a nice one to remember. We spray again, we get to them to breathe 4 times. And you might repeat that every 4 hours, just to get a feel of if that helps the cough and the wheeze. As I said, this Ventolin can attach onto any size of spacer. There's the larger spacers for the bigger kids who can put their mouth around the end, and the smaller spacers for the kids to take to school or if you're travelling.